Hello, Dr. Huffman from Florida Injury Medical Centers. If you live in the new Smyrna Beach area and you've been involved in a motor vehicle collision, give me a call for a free consultation, 386-402-4250. I'm an osteopathic physician. I've been involved in auto injuries for over 30 years. I know what needs to be done, does not need to be done. I know how you should progress with your treatment in an injury. I know how to report injuries. It's important that the injuries are reported within 14 days. Whether you're at fault or not at fault, you both need to report injuries. If you don't report the injuries, you have a little neck pain or back pain and you're brushing it off, and on the 15th day that becomes severe pain. If you've not reported it, you have no access to care. A lot of people at fault say to themselves, I don't want to report the injuries, my rates will go up. Well, your rates are going to go up anyways. You've been in an accident. Rates go up every year. I've never had a claim, and my rates have gone up every year for 30 years. So that's just the nature of that business. So it doesn't mean if you report injury that you have to get treatment. You can simply sit on it and watch your body heal. If your body heals over the course of a few weeks and months, you're fine. Just close it out. Say, oh, I didn't need anything, but you reported it. If you do, however, need treatment, you have access to it if you report it within 14 days. The option is to report it, go to your primary care physician who will not report it. You can call them and ask them if they treat auto accident patients, and you'll find they do not. The other option is to go to a local ER, urgent care, where you'll sit for hours among sick people, pay thousands of dollars to be diagnosed with no acute findings because they found no fracture. Well, there are acute findings if you have pain after a collision and you have limited range of motion in your neck or back, because those are soft tissue injuries like whiplash, and they should be diagnosed. I've been diagnosing those injuries, soft tissue injuries, for over 30 years. So I know what needs to be documented. The ER, urgent care, will send you home with medications that I could have called in to your local pharmacy or had delivered to your front door without you ever leaving your home. So if you do use our services, it's a simple text link to your cell phone. You tap on the link, you see me, I diagnose your injuries, I call in medications, I refer you into New Smyrna Beach chiropractic physicians, physical therapists, orthopedic neurology. I work with local injury attorneys. They like my reports because I know how to document injuries. I've gone to court, I've done depositions to support my findings. Many times you will find a case falls apart because on the front end somebody failed to make the proper diagnosis. So I know what needs to be done. As a primary care physician, I'll communicate with your primary care physician so he or she is in the loop. They don't treat this injury, but they want to know where their patient is and how they're progressing. And in many clinics, that just doesn't happen. There is no communication with your primary care physician. You go into a clinic that has no medical supervision. You have uncontrolled diabetes or other conditions that may be impacted by the stress of the injury. Nobody's keeping an eye on that. So give me a call for a free consultation. That includes not only new injuries, but injuries you're already being treated for. If you're under care for an injury and you're getting the same thing done day after day and you're not progressing, you're not getting MRIs, you're not getting referrals out, you need to talk to me about why that's happening and what should be happening for you. What is best for you, not for the clinic that you're in, but what's best for you. That consultation is free as well at 386-402-4250. Thank you.